and Family Council is a nonprofit organization that started in the mid-1990s as a consumer survivor initiative. Amber Scott from PCFC is here to talk about her lived experience with mental health and how the PCFC advocates for change in the healthcare system and broader community. Welcome, Amber.
Thank you.
So to start, what is PCFC?
Well, the PCFC is, as you said, a nonprofit organization. We kind of play several roles. We have, we offer services, peer support services, both in the community and within Waypoint, which is one of our contracts. We also do a lot of advocacy work. It's our experience and engagement department, so we do a lot of advocating for people that aren't able to advocate for themselves and bringing patient voice forward, trying to drive some of that system change for mental health and addictions. And that's really some of the larger work that we're doing, as well as helping people with lived experience learn how to share their story, and learning some of the skills that are needed to do that, as well as giving them opportunities to do that as well. So we're an organization full of people with lived experience, and that's it. Every single person up to our executive director, everyone has their own lived experience. So
can you share a bit about that? How did you get involved with PCFC?
Yeah, I got involved with PCFC. I was finishing up my social service worker diploma, and I really, during the time that I had done my schooling was some of the time that I struggled greatly as well. And I just wanted to use the experience that I've had to be able to help other people. That really was my only goal. It didn't matter to me how I did that. And I saw this job posting for a peer support worker with PCFC, and I applied for it, and that's how I ended up with PCFC. And I'm able to use some of my experience. I have experience back from when I was quite young, so I'm able to use that to help other people. And since then, I've made my way throughout the organization in multiple different roles, and getting to use that experience in different ways, which is amazing and something I'd never be able to do with a diploma. So it's really amazing.
So what is the benefit of peer support in supporting others in improving their mental health and self-care?
Well, I think there's just, with peer support specifically, I think there's something so unique and special about being able to talk to someone who has been in a similar situation. Because it's one thing to talk to someone that has, read the books, gone to school, read the books, and is like, I've read this, here, do this. This is what the book tells you to do, but has never experienced it. Whereas when you've experienced it and said, hey, this is what I did when I was experiencing a similar thing. And it's also really helpful to say, hey, I went through a similar thing and I got through it. And giving that hope to other people that this is a really unfortunate situation that you're in. It's it sucks. But you're gonna get through this. I got through it. You can get through it too. And just being able to give people hope. And that's not something that reading a book can give people. So I think that's something special about peer support, is peers meeting peers where they're at and giving them what they need and using their own experiences. So
what are the biggest mental health related needs you see in the community?
I think the biggest thing that I'm seeing right now is, right now I'm based a lot within Waypoint, which is the mental health center. And what I see a lot is people that are being discharged back into the community but don't have the support within the community, especially when it comes to housing. Like there's such a housing crisis, even for employed people. Like there's so many employed people that like can't afford housing. And it's either you have a house or you eat. It's one or the other. It's really horrible. So we see a lot of that, of people being discharged into the community with no plan in place, or no, like, that's part of mental health. Like, you need all of these pieces, and housing is included in that. You know, nutrition is included in that. And when you don't have all of these pieces, how can you have good mental health? So when you're being discharged from somewhere where you're already struggling with your mental health, how are you expected to succeed in that situation, right? So it's a big issue that we're seeing, that definitely needs to be dealt with, that's for sure.
And how do you deal with the stress of the job, trying to meet all these interconnected needs where there's no easy solutions in place?
Yeah, I think something I've just learned is, you know, doing my best, knowing that I'm doing my best to help other people, giving the resources I can give them, and knowing that that's as much as I can do. Because like I am one of those people that want to go to the end of the earth for other people, and I feel other people's pain, and I wish I could solve all of their problems for them, but I'm just, you know, we're not superwoman,
Right.
or supermen or super theys, so we can only do so much. So I think that's really what gets me through it, is knowing as long as I did everything that I could, just hoping that those supports will fall in place for them.
So where should people go to learn more about PCFC, or if they're experiencing mental health issues in their community?
Yeah, I would say just reach out to us, regardless of what you're looking for. If you're looking for peer support, we have our community peer support that you can call anytime. Like, we don't have a wait list, so you can call and say, hey, I need to speak to a peer support worker, and usually within a week we'll have you connected with someone. And if you're an organization that wants to figure out how to involve people with lived experience, we're happy to help with that as well, and guide you through that. And we sit on lots of committees as well, so if someone's ever needing, you know, the voice of the lived experience to bring that forward, we're there as well. So yeah.
Okay, perfect. Thank you so much, Amber. Thank you for coming in today.